Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, and here from the JWC studio today, I've got the stalwart Mr. Anand Alurkar. He is a leading neurologist here in Pune and in the country, and it's an honor to finally have you here, Doc, to talking about everything from the head to the toe, mostly from the head and everything inside. But thank you so much for being here, Doc.
You're welcome. Thank you, girls, for having me here.
So why don't you just start by telling us what is it that you do? It can be a very complicated thing, the brain. So
Yeah. I'm basically a neurologist by training,
okay,
and I mainly focus on stroke. And within stroke, also, I focus mainly on neurointerventions.
okay,
In short, treatment of stroke without opening the skull. So I do procedures in stroke patients without opening the skull and through the groin artery.
okay,
So that is basically what I do. But you can say that I'm basically a stroke specialist.
okay. And I mean that's such a big word for people, stroke, aneurysm. So what is one of the things or the main thing that you think that people should know about when they hear the word, or what people think they know about the word?
Yeah. So many times this word is confused with heart attack.
Right.
When we say stroke, some people interpret it as a heart attack.
Yeah.
So in fact, it's the other way around. Stroke can also be called as a brain attack.
As a brain attack.
Brain
Okay.
attack. So the basic pathology is the same in both. In heart attack, the blood supply to the heart is affected, gets blocked. And in stroke, the blood supply to the brain gets blocked.
Gets blocked. Okay.
There's only one type of stroke, that is
Yeah.
called as ischemic stroke.
It's called the
Ischemic stroke.
Okay.
So when the blood supply to the brain is blocked or affected, it is called ischemic stroke. And when there is a bleeding in the brain causing paralysis,
Okay.
it is called as a hemorrhagic stroke.
Right.
And the common thing in both is that patient ends up suffering from paralysis.
I see. Yeah.
There's another word. So there is a lot of words which are used interchangeably for stroke.
Okay. Yeah.
But paralysis and stroke, I think, are the most commonly used.
Right. And I think between both of them, there's also, or perhaps for both of them, there's something very important about getting someone who's suffering from one of them in time to get cured, or not cured, but to get addressed as soon as possible.
So mainly in ischemic stroke, the time is of the
that's the one with the clot. That's the one with the blockage.
Yeah, there's the one with the blockage of the blood vessels in
Right.
the brain. Time is of extreme importance. By extreme importance, I mean that every minute counts.
Yeah.
So every minute that the blood supply to a part of the brain is blocked, millions of brain cells are dying.
Wow.
That is what the mathematics behind it is.
Wow. That's
And 1 hour is equal to few years of the patient's life. So every minute we waste, millions of brain cells are dying, and every hour we waste, the patient's lifespan is getting reduced by a few years.
wow.
Right? So that is the importance of time. And why is the time so important? Because after the blood supply to the brain is blocked, brain does not permanently get damaged immediately.
I see.
Nature or the brain or the human body gives us some time to address the situation, to reverse the problem.
Okay. So it's giving us a chance. Huh?
Yeah. So some part of the brain dies immediately.
Yeah.
But there is a large part around this core dead part, which is still partially alive, you can say.
Okay.
And that dies over a period of time. So that period of time, in that period of time, if we act and open up the blood vessel, there is very good likelihood that the brain will survive, and which leads to a very good recovery.
Okay. Is that what people always refer to as this golden hour period?
Golden hour, yeah.
Okay.
Golden hour in brain, what we call is a window period.
Okay.
Golden hour is a very good way to
Analogy or whatever you want to call
it's a
it.
very good analogy because the hour comes in. So within this hour also, now here the window period is around 4.5 hours for
Okay.
for a drug which we give to dissolve the clot,
Right.
and it is about 6 to 12 hours depending on the patient's various parameters of the patient for a procedure that is called mechanical thrombectomy.
Okay.
So the important thing to remember is even within this period, earlier the better.
Of course. Okay.
yeah.
As you said, I mean, million brain cells per minute.
Yeah. So some people think that I can afford to wait for 3-4 hours to go to the hospital. It's not like that.
Yeah.
So within those 3-4 hours also, if I reach the hospital in half an hour or 1 hour, my outcome will be better as compared to if somebody reaches in 3 or 4 hours.
Right.
So that is the outer limit, 4.5 hours and 6 to 8 hours.
Yeah.
But within that also, earlier the better.
Absolutely. Well, taking one step back before even the golden hour period, what are the kind of symptoms that that crop up when you get this blockage or when you get these aneurysms? What are the things that we should be
So
keeping an eye out for?
I always tell my patients or the families or whenever I give talks in the lay public that stroke has to be diagnosed at home. I keep comparing it with a heart attack. So if you imagine person is having chest pain and sweating at home,
Yeah.
I think 90% of the time the family would come to a conclusion
Heart
that
attack.
this looks like a heart attack.
Right.
So that they would just rush the patient to the hospital. So for some reason this does not happen with stroke.
Interesting. Okay.
Yeah, so because stroke doesn't cause any pain and there is no painful symptom with stroke.
Right.
So it is often neglected. So any symptom which is coming on one part of the body, one half of the body, and which is coming on suddenly or within a few minutes to hours, has to be considered a stroke unless proved otherwise. For example, difficulty in seeing objects on one side,
Okay. Vision. Right.
vision, affection of the vision on one side, double vision,
Okay.
or deviation of the face to one side while speaking,
Okay.
or slurring of speech,
Right. Right. Right.
or heaviness of the arm, or heaviness of the leg, or losing balance to one side. So all these symptoms which are coming on one side and which come on acutely as we call it or within minutes to hour or minutes,
It comes on that fast, huh?
it comes
So
on that
one on top
fast.
of another.
Yeah.
Okay.
Some strokes they evolve over a period of few hours, but majority of strokes they come on within minutes.
Right.
So any symptom coming on one side of the body and which comes on so suddenly has to be considered a stroke unless proved otherwise.
Okay.
Then only the family will, even if the family doesn't realize that the patient is having a stroke, they will not take action.
Yeah.
So that is what happens most of the times. Few hours are wasted in coming to the realization that this might be a stroke. Then significantly more time is wasted in going to hospitals which are not stroke ready or going to the general practitioner, things like that. I've got nothing against general practitioners or physicians, but then when the patient has a stroke, the patient has to reach to a place, to an hospital, which has all the equipment and the expertise
Yeah.
available. Like in short, which is a comprehensive stroke center as we call it.
Right.
So these are the symptoms which the family should look out for so that action can be taken immediately.
Yeah. I mean, it's so important. The way you said it is that people should assume that it's a stroke, even though if it isn't. Rather be thought of a fool than proven one later.
Exactly. At the most, what will happen if the patient is brought to the hospital saying that we think it's a stroke? It may not be a stroke, and they should
for
be sent
happy.
back. They shouldn't be sent back.
Yeah.
Go home with the good news.
But it's
But better than being neglected.
absolutely so. Err on the side of caution is what you're saying, or in this case, on the side of worst case scenario potentially.
Yeah, absolutely.
But coming back then, taking one step back, even if we get before to the symptomatic stage, what are the kind of things that people can do to prevent this kind of thing happening? And
Yeah.
is it also something that only happens at older age, or is it happening at younger ages? We'll come to that next. But what can we do on the preventive side?
Yeah, on the preventive side, I think we have two groups we can call it. One is a lifestyle change, and second is management of the risk factors. So the usual risk factors for blockages of blood vessels in the body, anywhere in the body, are the same actually.
Okay.
So whether it's the heart or the leg or the kidney or the brain, blockages of blood vessels are produced by certain specific risk factors. They are common risk factors. And as far as the brain is concerned, the most important one would be blood pressure, high blood pressure.
Okay.
So if the patient is suffering from hypertension, diabetes, high cholesterol, smoking is an extremely important risk factor,
Yeah.
sedentary lifestyle, obesity, and family history. These are the top 5 or 6 very important risk factors.
Okay.
So controlling these risk factors like stopping smoking, some things are absolutely under control.
Absolutely. Yeah.
Increasing the activity, taking care of your diet,
Yeah.
so that you don't end up having a high fat diet or high carbohydrate diet. And these are modifiable risk factors as we call it. Even control of blood pressure. Here I would like to point out that just starting the blood pressure medicine is not enough.
Okay.
So many times what happens once the blood pressure is diagnosed, a physician starts the BP medicine, and we find many times that the patient just is lost to follow up. Patient takes the BP medicine for years together without even rechecking the BP.
Oh wow. Okay.
Yeah, so the blood pressure has to be monitored and the dose has to be adjusted accordingly. So just taking the medicine blindly for months to years is not the solution. Similarly, diabetes, regular checkup of the blood sugar, controlling the blood sugar in a certain level, etc., is extremely important. Checking your cholesterol, total lipid profile. After the age of 50, I would say every year or so, all these tests have to be done.
Absolutely.
The sugar, the creatinine, the kidney function, and the lipid profile, etc. So doing regular checkups and early detection of these risk factors and controlling them
Right.
would be absolutely important.
So you're saying it's vital for everyone to be doing health checks, wellness checks every year at least.
Absolutely.
Yeah, absolutely. I mean, I've been doing them now pretty much every year from the age of 20 now. So,
Yeah.
but it's absolutely correct what you're saying. I think it's an absolute.
Earlier the better. I mean, if something is picked up earlier, obviously the risk of stroke will
Yeah,
go
yeah.
down.
Prevention is always better than cure.
Yeah, in stroke, this prevention is better than cure adage is, I think, even more important.
Hugely.
Because the disability after stroke is what we are mainly worried about.
Yeah, absolutely.
Mortality is there actually, but disability is even more worrisome.
Yeah, because your quality of life goes from.
Quality of life goes for a toss. The family is totally disturbed.
Right.
Apart from the financial problems that the family has to face, taking care of a bedridden person at home, sometimes in a very small home, with people going for work, there's nobody to take care of the person at home. I mean, I have seen the families getting devastated.
Absolutely. And what you're saying is so true, because it's not compared to, or when you first started talking and comparing it to a heart attack. I mean, heart attack is obviously very severe thing as well, but it may not leave someone in the same kind of state of quality of life that someone with a stroke would have. So it's actually, what you're saying is absolutely
Right.
very, very vital.
So one more thing I would like to point out here is a concept of what we call as a TIA.
TIA. Okay.
Transient ischemic attack. I think I would not be remiss in saying that probably this is the most important part of today's podcast.
Okay.
This realization of a transient ischemic attack, TIA.
Okay.
So again, comparing to the heart attack, we see many times that before a major heart attack, many times the patient gets chest pain for a few times and then the major heart attack comes if action is not taken.
Yeah.
So similarly, in about 1/3 of patients of a major stroke, TIAs come. Like these are small episodes of stroke basically, which improve in few minutes.
That improve in a few
Few
minutes.
minutes. So just slurring of speech for a few minutes.
And then it stops.
Yeah. And weakness of arm for a minute or so.
Huh.
It is in 90% of the times, this is misdiagnosed as something else by the patient, by the family, even by GPs and physicians.
Wow.
That this could be just high blood sugar, this could be just tiredness, this could be just stress, this could be just low BP, high BP, all sorts of things. But this is actually the body telling us, giving us a warning signal that something is going wrong and you need to take action.
I've never heard, actually, honestly, I've never heard of the term TIA until you said it, or the symptoms that you're talking of.
Yeah, so this is an extremely important concept of diagnosing a person at the stage of a TIA and taking action so that a major stroke doesn't follow.
But in your experience, and how, like, this TIA, if something like this happens, and if they don't do anything about it, then and you're saying it's like a precursor to a bigger stroke or a major stroke, what is the time gap between these episodes and to this large episode?
Yeah. So sometimes the TIAs lead to a stroke within days.
Okay.
Sometimes the episodes come daily and then third, fourth day the major stroke.
Right.
But many times the body gives us time. The major stroke can come even out few weeks to months after the TIA.
Okay.
So major stroke coming on after a TIA is more common if the TIAs are longer in duration. So compared to a few seconds, let's say my slurring of speech is lasting for 5, 10 or 15 minutes. And if the episodes are coming frequently, then it's very likely that I would end up with a major stroke.
This is actually fascinating. Because honestly, it's the first time I'm hearing of the term TIA, and I think it's hugely important for people to know this as a potential great early warning sign in that sense as well. So what happens if someone has this episode, what should they do then? Same thing. Should they come to the hospital, rushing to the emergency room, or be like, I'll go see the doctor today?
No, the patient has to be taken to a stroke-ready hospital or a major hospital as early as possible. The same day preferably, because we don't know when the major stroke will follow.
Yeah, right.
Although it may come after a few weeks to months, or it may not come at all. But we don't know. It might come the same night. So if the patient has had a TIA, best to rush the patient to the hospital. So what is done in the hospital is the patient is kept under observation for a day or two, and within that period, we do certain investigations on the patient
Yeah.
to see why this thing is happening. So many of these patients are not diabetics or not known hypertensives. So many times these problems are detected after TIA. So we come to know what are the risk factors. We do certain tests to see if there are any blockages in the blood vessels to the brain,
Right.
like the carotid Doppler, the MR angiogram, and in selected cases, what we call as a DSA or digital subtraction angiography.
Okay.
Just as
What is that exactly?
DSA.
Okay.
So just as cardiologists do coronary angiogram for the
Right.
heart,
Yeah.
we do DSA for the brain.
Okay.
In the same, the same procedure, only the person doing it and the organ is
As
different.
a neurologist.
At
Yeah.
the same place where the cath lab where both the things are
Okay.
done.
Right. Right. Right.
So in all these tests, after all these tests, we come to a total conclusion why this patient is having this particular symptom, and if there are any major blockages or severe blockages in the blood vessels going to the brain, we can address those blockages. So up to about 50%, we manage these patients on medicine, and science tells us that if the blockage is above 50%, medicines are usually not enough, and the patient may end up requiring procedures. So this is this is where my expertise comes in.
Absolutely.
The procedures like carotid stenting, intracranial stenting, etc.
But again, the important thing is that you're addressing all of this before there's a major event.
Before the major event
And then
comes.
everything that we talked about,
Yeah.
what follows is
Right.
completely avoidable.
Right.
That's actually incredible information, Doc. I didn't know that. So thank you so much for sharing that. Absolutely. But as you said, I mean, just hearing you, you've got a wealth of knowledge in everything that you've talking about for the brain. What do you do for your wellness to make sure that you're ticking away?
Frankly, not much.
Okay.
Of course, routine checkups, obviously, I've been doing since
Right.
the age of probably 40, 45.
Right.
And that is very important actually. But as a busy physician, I would say that regular exercise and things like that, I still lack in that.
Okay.
So like many of us doctors actually,
Right.
we don't care we don't care as much of our bodies as we advise other people.
It's an
as we
interesting
advise other
psychological
people to do that.
experiment. But if you had to leave us with one or two main sort of takeaways for what people can do to keep a healthy brain, how would you leave us with?
Yeah.
What would you leave us with?
So healthy just as a healthy body is an active body, or an active body is a healthy body.
Right.
The first thing is, I think, if your brain is active, then obviously it will be healthier than somebody whose brain is not active. So one has to keep busy mentally.
Right.
Secondly, look out for these
Oh, interesting.
factors.
Sorry to interrupt you. That you're actually being busy mentally, not just.
Yeah. So studies have proven that people who have been mentally very active in their working duration when they are
Okay. Yeah.
lifespan, they have a lesser tendency to get dementia.
Right.
So it may not be related directly to stroke, but definitely a healthier brain or a more active brain in patients who have a more active brain, the incidence of dementia is less
Yeah.
as compared to those who.
Yeah, that's why there's a lot of advice about people to play a lot more card games and Sudoku and these kind of math kind of puzzles.
These things do help actually.
Right.
Yeah.
Anything else? Any last words you like to leave us with?
Yeah. So I think the message I would like to give is look out for symptoms of stroke.
Absolutely.
Look out for risk factors of stroke, control of risk factors for stroke. And one should know that science has advanced remarkably in the last 1 or 2 decades. And literally the sky is the limit as far as stroke treatment is concerned. As I said, we are doing stenting for the blood vessels going to the brain, angioplasties. We are doing a procedure called mechanical thrombectomy, wherein basically when a patient comes to us with stroke,
Right.
once we detect that the patient has a large vessel occlusion, as we call it, a major blood vessel to the brain is blocked, we take him to the cath lab, we go in through the groin artery,
Yeah.
we open a stent. It is a special stent called a stent retriever. We open a special stent in the clot, and the clot, we wait for some time, few minutes, the clot gets entangled or stuck in the stent, and we remove the stent outside the body, and the stent brings out the clot along with it.
Wow.
So this is it is one of the most effective treatments on the human body. Based on clinical trials and guidelines, in our field, in our science, there is something called as NNT, or number needed to treat.
Number needed to treat.
Treat.
Okay.
So, for example, if I treat 10 patients, one will improve.
Hmm.
One is likely to improve.
Okay.
So, the NNT is 10, something like that.
Wow.
So, lower the number, more effective is the therapy.
Of course, yeah.
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 So, this mechanical thrombectomy has an NNT of, in some trials, 2, some trials 2.5. It is much more effective than even stenting for the heart. It is much more effective than even giving DC shock in an ICU patient.
Yeah, yeah.
Life-saving procedure. So efficacy-wise, it has been proven to be a very excellent and effective procedure.
That's
There
fantastic.
are many other procedures which we do, like aneurysm coiling, AVM embolization.
yeah.
So science has advanced a lot in the last couple of decades. And I personally think that all our listeners or patients
Yeah.
should take advantage of these advancements.
Absolutely. And it's reassuring that we'll have someone like you having to take care of us if and when, God forbid, we need that. Well, Dr. Alurkar, it's been an absolute pleasure having you here. It's
Same
been incredible being able to pick your brain.
Yeah.
No pun intended. But your wealth of knowledge has really, really helped, I think, a lot of our listeners today, and especially me, especially hearing about things like TIA and how we can actually address a lot of these things before it becomes a major issue, and how there is hope for being able to do that. So I think today has been really enriching. So thank you so much for being here.
Thank you for having me here. It's always a pleasure to share my knowledge or whatever information I
Absolutely.
can share about stroke. Again, prevention is better than cure as far as stroke is
I
concerned.
think that's a lovely last words to leave us with. Thank you so much, Doc.
Welcome.
Thank you.
Thank you.
Thank you all, and we will see you for next week's episode. But before you leave, do not forget to hit the like and subscribe button here at the bottom. Thank you.